My name is Dylan Papafus from San Jose State University, and today I'm presenting for you infectious lung diseases and how it impacts the elderly disproportionately compared to other age demographics. So, an overview of this topic. Some common infectious lung diseases that we hear about today often are COVID-19, influenza, RSV, which is respiratory syncytial virus, and COPD, which is chronic obstructive pulmonary disease. People of advanced age are particularly vulnerable to these diseases due to the effect of aging on the body's ability to fight off infection and produce antibodies. This is important to understand that the elderly are at a higher risk for these diseases and what you can do to help them. All right, some background information on this topic. Common pathogens like COVID-19, influenza, or COPD can often cause comorbidities. And comorbidities are when two or more diseases are present within a patient and make each other worse. For example, if you were to have COVID-19 and then also get pneumonia, the effects of pneumonia could be much more severe and potentially even fatal due to the body's already weakened immune response from fighting off COVID-19. Now, these diseases are very common, and it is recommended that you are immunized for them every year through vaccines. While they are usually present very mildly in healthy individuals, they can become very contagious and much more dangerous to unhealthy or to elderly people who have weakened immune systems and the weakened ability to fight off these diseases. So a little about aging and immunity. Aging can lead to weaker immunity due to the body accumulating senescent immune cells, which means that the existing cells become weaker and less of them are produced. Other cells, like T and B cells, which are basically the cells that train cells to fight against diseases and also the ones that fight them off themselves, become weaker and less prevalent within the body due to advanced aging. The elderly also become more prone to severe infection and complications that can come with it. Things like comorbidities become more severe and even fatal. Chronic lung diseases can affect the daily life of the elderly and can cause symptoms like breathing problems and sometimes even lead to death. Some key diseases that affect the elderly. So COVID-19 is a big one that's pretty recent and pretty relevant to a lot of people today. And for this disease, the people of advanced age are at a much higher risk of infection and severe outcomes. COPD symptoms can become very severe and even difficult to identify within patients, especially the elderly, where a lot of these symptoms are often mistaken for just some signs of aging. RSV is another one, and it leads to complications in the lower respiratory system and can be more dangerous for people with diabetes as well as a comorbidity. Influenza can have more drastic effects due to the aging immune system, and it can cause chronic and long-lasting respiratory symptoms than those who are afflicted by it. Within recent news, COVID-19 has caused an alarming amount of deaths among the elderly and continues to affect long-term health even to this day, now that the pandemic is over. RSV has also been found to have a later season than usual these last few years. It is becoming much more severe for the elderly. And this disease can also be very costly to treat as well. Comorbidities like pneumonia and bronchitis are increased when RSV is present, and they are also much more dangerous and severe. Some ethical considerations to take. More equitable access for seniors should be prioritized in respiratory disease prevention and treatment. This is important because to many people, these diseases are not that severe and can be very mild, like a cold. But to the elderly, these diseases should be taken much more seriously, as they are much more dangerous and they are also much more prone to infection from them. Recognizing less common threats that can still be dangerous is also important. Just because a disease is not as common as something like the flu or COVID does not mean that it is not as dangerous. And this is especially important because these diseases, because they are less common, are much harder to identify, and some of the symptoms might not be as noticeable as the other more mainstream diseases. It is also important to balance the costs for care for high risk and long term patients. This is especially important because the longer that you are receiving treatment, the longer those bills can pile up, and this can be extremely costly for some people and may deter them from seeking treatment if they think that they are unable to afford it. Finally, it is also very important not to spread misinformation that could be harmful. Misinformation such as misinformation about vaccines can deter people from seeking treatment and prevention, and this could lead to them becoming sick and make it harder for them to make informed and healthy decisions for themselves. Academic integrity issues. So it is very important to use accurate epidemic data. You want to have the accurate and true stats available for people who want to make informed decisions about their health. It is also very important to use peer-reviewed sources to avoid data manipulation. The more peers you basically have on a source, the more likely it is to be reputable because you have more experts in the field reviewing it and agreeing that that is a good study. It is also important to share accredited data, again, so that people are able to use it and make informed decisions. And it is also very important to acknowledge limitations based on biases in studies like population exclusion. This is important because if all populations are not considered, the data can be skewed, and it could lead to people who are excluded in that study not being able to make informed decisions based on the data. Policy and changes that could be beneficial. So the need for better screening for influenza and RSV for seniors is crucial. This is one of these diseases where it is very hard to identify it in its early stages in elderly patients because a lot of the symptoms are just simply mistaken for signs and symptoms of aging. And this is pretty problematic because if you identify these diseases too late, they can become very dangerous and possibly fatal for the elderly population. So better screening and faster screening is really crucial when treating patients for these diseases. Targeted vaccination and health interventions for the elderly patients who have comorbidities. So this is also equally important as a part of the treatment and prevention part of fighting off these diseases. Targeted vaccination, for example, COVID vaccines for the elderly and vaccines for other infectious lung diseases can help these elderly people build up the antibodies needed to fight off these diseases and prevent getting them in the first place. And health interventions for patients who do have comorbidities, say like diabetes or pneumonia or something that may be chronically affecting them, it is important to take this into consideration and provide the proper interventions needed to make sure that these comorbidities do not get much worse due to these infectious lung diseases. It is also important that we have more ethical training for healthcare professionals treating the elderly. Um, this is a pretty important one because treating an elderly patient isn't necessarily always the same as treating another patient. It could be a lot more difficult due to their advanced aging. They might not necessarily understand all the treatments that are being given to them, and it may also be harder for them to just hear it if you speak to them regularly like you would for another patient. It is also very important to make sure that you treat them physically with respect as well, because older people may often also be more fragile. In conclusion, infectious lung diseases are a major threat to the elderly. Diseases like COVID-19, RSV, and influenza, and COPD require ongoing ethical and data-driven response. Utilizing both academic responsibility and ethics in practice are essential for the best outcomes. All right, and here are my sources. Thank you so much for listening.